Today I'm going to talk about turmeric and Advil, two common options for pain relief. How to choose between turmeric and Advil for your pain and inflammation. Can you really use a natural remedy to treat your pain instead of a synthetic drug like Advil? And what does the scientific research say about their comparison? Let's find out. Turmeric is a spice that comes from the root of the curcuma longa plant. It has been used for centuries in traditional medicine for its anti-inflammatory and analgesic properties. Turmeric contains curcumin, the main active compound that gives turmeric its yellow color and health benefits. Advil is a brand name for ibuprofen, which is a type of nonsteroidal anti-inflammatory drug, NSAID, that works by reducing chemicals that cause inflammation and pain in the body. Advil is commonly used to treat headaches, fever, arthritis, menstrual cramps, and minor injuries. Let's start with some clinical research results on turmeric in the recent years. Study number 1. The study involving 367 patients with knee osteoarthritis found that taking 1,500 mg of turmeric extract per day was comparable to taking 1,200 mg of Advil in terms of reducing pain and improving function after 4 weeks. Both treatments were well tolerated by the patients. Study number 2. The study involving 139 patients with mild to moderate knee osteoarthritis found that taking 500 mg of turmeric per day was as effective as taking 100 mg of diclofenac in terms of reducing pain and inflammation after 4 weeks. Diclofenac is an NSAID, similar to Advil but requires a prescription. Turmeric also had fewer side effects than diclofenac. These studies suggest that turmeric is comparable to Advil and other nonsteroidal anti-inflammatory drugs for pain relief, especially joint pain, with fewer side effects. Turmeric could be an alternative treatment option in the patients with joint pain who are intolerant to the side effects of nonsteroidal anti-inflammatory drugs including Advil. However, turmeric also has its disadvantage. For example, turmeric has low bioavailability, meaning it is poorly absorbed and utilized by the body. It needs to be combined with other substances, such as black pepper or fat, to increase its absorption. It may have a bitter taste that some people may not like. It may also stain the teeth or skin if used excessively. It may cause gastrointestinal bloating and may worsen gallbladder problems or increase the risk of kidney stones. On the other hand, although Advil could cause serious cardiovascular and gastrointestinal problems, it also has its advantages. For instance, Advil is fast-acting and effective for acute pain and inflammation. It is widely available and affordable over the counter. Advil is more effective in treating fever and swelling. Now that we have a better understanding of the strengths and weaknesses of turmeric and Advil, the choice of one or the other depends on your situation and needs. While the benefits seen with turmeric are encouraging, the evidence for turmeric for pain and inflammation is not conclusive enough for it to supplant Advil or other NSAIDs. Also, the number of patients involved in those clinical studies was relatively small and larger sample size studies need to be conducted. If you want to switch to a high dose of turmeric from your current use of Advil or other NSAIDs, be sure to consult with your treating physician first.